My name is Lyndsay Prange, and I'm a nurse practitioner at Duke. I work in the pediatric neurology department. I'm involved with AHC in working with the different, particularly neurology, but with the different specialties within our AHC Multidisciplinary clinic here at Duke. I became involved with AHC when I started working at Duke about almost 3 years ago. We started the AHC Multidisciplinary Clinic here about 1.5 years ago. It's been a work in progress, but it's really taken off. So what have I seen change in terms of AHC over the last 1.5 years with our clinic? I've seen really knowledge grow about it. Parents become more empowered as they learn about it and get a name for their child's disorder, and kind of become empowered in learning more about it, prognosis, what to expect. Also, with our multidisciplinary clinic, we've worked to arrange other families, so return patients as well as new patients on the same day, which has helped with them getting to know each other and supporting each other, realizing that there are other children with the same disorder. Yeah, so at this point, we're seeing new AHC patients once a month. The multidisciplinary clinic is usually over 2 or 3 days. We organize different specialties throughout that time. So the new patients come once a month. So we've probably seen 25 or so patients with AHC so far within our clinic. I would describe AHC as a rare and unique disorder that has multiple symptoms. No two patients that I've seen have been the same. It, as the name implies, involves alternating recurrent hemiplegia, so loss of tone and movement on one side of the body or the other. Can involve both. It involves abnormal eye movements, dystonia or abnormal posturing, ataxia or loss of coordination, choreoathetosis or kind of twisting, writhing movements, as well as seizures and developmental delay. There is a spectrum and kind of different phases to the symptoms as the child grows. I think parents enjoy the clinic because it's a place where people understand the disorder, and you ask about symptoms, and no one's ever asked about that before or understood the different symptoms that they have. The fact that there is medication to help with some of their spells. I think the AHC Multidisciplinary Clinic has been extremely helpful to patients in exploring more of their symptoms and giving them answers. Oftentimes when they come to us, they're confused about the different symptoms, whether they're seizures or not seizures. So really going into detail and figuring out what is a seizure, what is an AHC episode, is really enlightening to the parents. There's a little girl that I'm thinking of, her name is Lexi, that recently came to our clinic. We were able to really get to the bottom of her different symptoms and what was seizure activity and what was not. Being able to treat the seizures and figuring out that even though this may look like an alternating hemiplegia spell, it was actually seizure activity. And so we were able to provide her with better seizure control, and it's really improved, I think, her quality of life. I think my hope for AHC in the future is that we're able to improve awareness and improve treatments and medications for these children. It's a pretty rare and unique disorder that these patients can really benefit from getting to know each other and becoming support systems for each other. The patients I've met with AHC are really, really amazing, resilient, determined little people, and I think that they deserve the best medical care possible.